evening, Assalamu alaikum, and a very warm welcome to Visionary Pulse. With me, your host, Farzana Mayet, focusing on segments that really shine the spotlight on game changers and change makers. And tonight is certainly no different as we chat to one such game changer and change maker. So we speak to Zafreen Valli, who is a medical practitioner based in Emmarentia, Johannesburg, with a special interest in travel medicine, women's health, and general well-being. Her consultations are patient-centered, whether addressing acute or chronic conditions, with a holistic approach as well. She is the co-founder of the non-profit organization Care for You Too Respite Outreach, which works with cognitively challenged children and their families through respite care. That is definitely a short break for parents, caregivers, and outreach programs such as this that assists with devices in the form of specialized wheelchairs, standing frames, and much more. Zafreen, Assalamu alaikum, and a very warm welcome to Visionary Pulse. Thank you so much for joining me.
Walaikum salam wa rahmatullahi wa barakatuh. Jazakallah so much to you, Farzana, for having me on the show. And of course, bringing Care for You to Respite Outreach onto a media platform.
Absolutely.
I really thank you.
I think this needed to be a spotlight, and this needed to be in the spotlight, and I think you're doing such amazing work that our viewers need to get to know more about Care for You too as well. So Zafreen, a woman with such a vast profile, how do you find the time to manage it all?
So alhamdulillah, Farzana, the trick is for me, every morning I wake up and I tell Allah subhanahu wa ta'ala, I need to get my day done. How
Please
this
assist.
is going to happen, it's in your control.
Right.
But in all honesty, it takes perseverance, and it takes sorting out your day, allocating time for certain things every day. Now, when you run a non-profit, it's difficult. Your day starts with so many things in the morning, with meetings, admin work, all of that. So I ideally start my day way before I go into my own practice.
Oh, okay.
So
your day starts even before your day starts, so to speak.
Exactly, because it's the only way sometimes you can then focus on a second aspect of your day.
Okay.
So as in so much, the West keeps saying you must multitask. But let me tell you, multitasking can help, but at times you need to give one thing your attention, one thing at a time. So imagine me having a patient in front of me, and then the company calls in the middle of my consultation and saying, "Oh, Dr. Valli, your wheelchair is stuck somewhere in the middle of Cape Town and Durban. Oh my God, I'll lose it." And that's ideally not acceptable. You need to concentrate, and you need to do what you need to do with these type of things, especially so you don't make mistakes. In our type of work, you cannot allow to have even the smallest mistake, because children are dependent on us. Families
Absolutely.
are dependent,
And they're all dependent on you, so how's the pressure?
It is a bit much, but
Gee.
I think the important thing here is that you have an understanding.
So true.
And also for us to realize that everything happens in its time and place. We don't have control of everything.
Yeah.
So you start your morning and say, this must happen, this must happen. Trust me, when you do that in a day, everything opposite will happen.
Gee, absolutely.
So I think take it in your stride. Know that there are going to be mishaps in your day. Work around it. Make time for it, because on a
No, I love
busy
what you're
schedule.
saying. You've got to just take it in your stride. It's no use getting upset, getting worked up. It's not going to help anything.
It doesn't. And what happens to you at the end? You'll end up shouting, you'll end up screaming to the people that are closest to you, your secretary, your maid, your children, your husband. People that shouldn't be getting the brunt
In the firing line.
in the firing line. They shouldn't be the ones to be taking on all of that. It's not their fault that your delivery didn't happen. It's not their fault your patient was late. It's not their fault that you had to be running late for a meeting because of the delay that happened in the morning. So I think I'm doing this quite a long time now, Farzana. So
Okay.
I think the best way to manage your day is to manage yourself. And for
I
that,
love
you
that. You've got to manage yourself.
You've got to manage yourself. And you need help. You cannot do everything yourself.
It's so interesting that you just mentioned that, because this year I've been now already 10 years, 11 years in the business, and this is the first year that I've decided in the power of delegating tasks, because I felt I could do it all.
No,
And this year
absolutely.
showed me flames that, listen, you can't do everything yourself.
Yeah, absolutely. I totally agree. If it isn't for a team,
Gee,
you can't. You'll fall down. There's only so much one person can do.
burnout is real.
Burnout is real. And I mean, look, the thing is, for any successful um, project to happen, there's always people in the background.
Behind. Gee, definitely.
So if you are not going to take on to their expertise, because remember, everybody comes with their own expertise.
Definitely.
So use them for the expertise that they're good at.
Exactly. And it makes many hands make light work.
Exactly.
Okay, so Zafreen, a general practitioner with a special interest in women's health, what made you want to take the special interest in women's health predominantly?
Okay, so for me, a woman is the foundation of her home.
Absolutely.
And if that foundation cracks, there's going to be trouble. Now, please don't get me wrong, fathers are just as important,
Gee,
and their role is vital as well. Their health also is mostly important. Not mostly, of course it's
it
important.
is definitely important.
But
yeah.
a mum is the one that holds the ground. She's everything in a home. And if she's, let's take a typical example. If you or I get ill one day and, you know, literally everything comes to a standstill in the home.
Definitely. She
You
is
know,
the backbone of
She's
the
the
family.
backbone of the family. So if she doesn't look after herself, then who's going to take care of the rest of her family? And she's not only a mum, she's a daughter, she's a wife, she's a
She wears so many
daughter-in-law.
hats.
She wears so many hats. And to be able to keep all of that hats on, plus go to work. I mean, that's the reality in today's
That is.
world.
It's the harsh reality.
It's the harsh reality. So I think women need to take care of themselves mentally, emotionally, physically. Go for their checkups. Come to your doctors. Come to your GPs.
Don't put it off.
Don't put it off. Don't say, oh, something came up, I'll postpone this for tomorrow. No. Put yourself first. Because once you take care of yourself, you can take care of everything else after that.
And that's something I think you will agree with me, Zafreen, that a lot of women, if not many, if not 80% of us women, tend to put our health, our well-being, our mental health on the back burner.
Yes, we definitely do.
And we don't take that paradigm importance to sit back and reflect and think to ourselves. And I love what you've just said. If you're not going to function at optimum level, your family is going to suffer. Somewhere along the line, there is going to be that ripple effect.
Definitely. I don't know if you know, let's take our mums, our grannies,
Yes.
great grannies. Some of us are lucky to have them in their lives. Look at their strength. I mean, we have aunts who are in the 80s and 90s that could still cook and clean and
want to do
mentally
very much
focused.
everything
They
themselves.
pretty do everything themselves. So you can imagine the strength that a woman needs and a woman requires
Absolutely.
every single day of her life, whether it's being at work and mentally being prepared to be in that situation, or being at home, looking after your children, doing all those school rounds and that aftercare and all the sporting activity. It's no joke,
It's
Farzana.
not easy. It is, definitely.
I think every woman that's juggling, just doing that, working from home or working from there, trying to be on time to fetch their kids at school, doing the madrasa rounds, doing the extracurricular activities, still cooking and still coming home and saying, okay, I now need to sort out laundry and ironing. I mean, that's amazing.
Absolutely. And a lot of women don't appreciate themselves and pat themselves on the back for what they're doing. A home executive, I think, is one of the most tedious tasks or one of the most difficult tasks that you can be doing, because there's so many things to take care of in the day, because the whole family is now relying on you. The kids are relying on you. The husband's relying on you for the home to be perfect. And there's just too much to do. It can become
Absolutely.
very overwhelming. I do agree with you. That is why your health needs to take paradigm importance.
Absolutely. And I know people don't like us doctors. I don't know why. But it's important. All women, take time off, especially after you're 40. Come and see us. Have your regular pap smears. Go for your breast exams. Do your routine bloods. Remember, for a woman, there is a change of every phase in her life that her body undergoes. In your early teens, you worrying about your menstruation. Then
Yes.
comes all the challenges, whether or not there's cysts, whether or not I have PCOS, whether I have endometriosis. Now going to the fertility phase of your life once you're married. Can I fall pregnant on my own? Can't I fall pregnant on my own? Then it's that journey. Then after that, slowly, body's starting to get ready for menopause. Then you come through your menopause
and there's
period.
that thing, the menopause to deal with as well.
Exactly. So the different stages in your life. And you as an individual, you know your body. You know when something's wrong. You can feel it, but don't put it off.
Exactly. Your body is giving you warning signs. Take heed.
Exactly. And there's nothing wrong to put yourself first, Farzana.
That's why I always tend to say, Zafreen, like you mentioned, our moms, our grandmoms, they always tend to put their health and well-being on the back burner, saying, I will sort it out. Even up until today, if we tell our moms, please go and get a checkup done, please go get something done. No, I will do it when I have the time.
Yes, yes. I think we need to focus and prioritize things. You know, I work with a diverse group of women, you must know,
Okay.
that
Right.
obviously cross my path on a daily basis.
Right.
And I must say, they're so dynamic, so dynamic. Each one brings something so special every single day of their lives, from actually learn a lot from my patients.
Really? But Zafreen,
Okay.
would you say times are changing now? Women are starting to take care of themselves. I would like to think so. I would hope that they are.
They are, but still not enough.
Not enough.
Not enough. Look, there are a lot of challenges also, Farzana. Things are not cheap out there.
Absolutely.
Medical tests are not cheap. I mean, blood tests, mammograms, pap smears, these things cost a lot of money.
Absolutely.
And look, let's face it, in today's times, most people had to do away with medical aid. Medical aids don't pay for these things nowadays as well. A lot of people had to downgrade to hospital plans, for example, which don't cover,
It
a
doesn't
lot of the
cover
things.
anything, yeah.
But somewhere along the line, if it's possible, let us speak to our spouses, let us speak to our husbands and say, on a yearly basis, I need to do 1, 2, 3, 4, 5. Even if it means I start putting a small portion on a monthly basis aside for medical
For that.
testing, just for basic baseline testing. Let us start. Let us make it a habit to say, my health comes first, no matter what.
So we touched on the baseline testing, Zafreen, for the benefit of our viewers out there who would want to know now, okay, fine, I'm now downgraded my medical aid to hospital plan, or we've done away with the medical aid totally because, I mean, in today's economy,
Yes.
medical, like you've mentioned, is really not affordable for many homes. So what is the baseline testing? What would a woman over 40, or let's say 35 and above, now require on a regular basis, like
So
yearly?
obviously it's patient dependent
Right.
and condition dependent as well.
Right.
So a lot of people, at 35 it's probably just routine,
Okay.
acute. You don't really need a lot,
Okay.
unless there is a strong family history of certain cancers.
All right.
Then that's a different story.
So you've got to now obviously assess your background.
Exactly. And that's a different story.
Right.
So and then your tests and what you need must be done in discussion with your GP. Have a doctor that you're close to. Have a doctor
Yes,
that
you've got
will.
to be.
You've got to. I know it's difficult, and I know. Look, doctors don't like doctors as well. We're humans, right? Who wants to be sick?
Right.
Nobody,
Absolutely
right?
not.
But take that first step. Come, sit down with us. We'll talk to you nicely. We'll set up a plan. Not always everything is necessary. Maybe in
Right.
your first consultation, you might just need a full blood count and a thyroid test. I don't know.
Okay.
Maybe the second one you need is just to check your vitamin D levels. Or then at the same time, you can say, no, Dr. Valli, actually, I can do 4 basic tests. Then dependent on what is,
Required, yeah, on
required or
patient,
from your monetary side,
Perspective.
what you can afford is what we'll do. And some patients will say, no, I actually can do the pap smear this month, and I can do the mammogram next month, and I can do my bloods thereafter. Work out a plan with your patients. It's doable. I do it. That's how you respect your patients. You understand where they're coming from.
Absolutely.
And if a patient tells you, Dr. Valli, I can't do it this year, then we say, okay, we can postpone it, but dependent on how urgent.
Okay,
the
yeah,
need
some
is.
things can't be put off.
Some things can't be put off.
Okay, so when a patient is now over 40, what would you suggest then?
So I would suggest basic bloods like your iron testing,
Okay.
right? Your vitamin D levels, your thyroid levels, very, very important. A general full blood count sometimes,
Okay.
otherwise a hemoglobin level is important. That for me by far the most 4 basic tests that I would do. Over and above, again depending on family history, if you're starting to have joint pains, then we need to look into those joint bloods
Okay.
testing. Pap smear, mammogram, vital.
That's absolutely vital.
Vital.
So, Dr. Zafreen, I just want to, something is which is really truly commendable, and that you are also the co-founder, and that's something that really why we're here, of Care for You Too. So, please elaborate for me, what is Care for You Too?
Care for You Too Respite Outreach is a non-profit organization working with special needs children and their families. We started the organization 13 years ago, Farzana.
13 years.
Yeah,
Wow.
13 years.
Okay.
And Alhamdulillah, to date, we simply grown by mouth, word of mouth.
Because I haven't really, yeah, you're right. It is word of mouth.
Yeah.
Okay.
So we have small fundraisers.
Okay.
We don't have fundraisers often, um, simply because, again, maybe fault on our side. All the board members are professional, in their
So
capacities.
the time is a
The
factor.
time is a factor. And also, it's a very unique concept. Unique in a way that what we actually do is something called respite care for the parents of these children. So, Care for You Too, when I talk of special needs children, the diagnosis that we cover is your cerebral palsy, autism to a certain extent, spinal atrophy, muscular dystrophy, and some of the bigger diagnoses where your children are unable actually to do anything for themselves. These children are bedridden. They can't talk. They can't walk. A few can, depending on the diagnosis. So,
Right.
some of them will just have learning disabilities. And that means they're quite functional in many other areas. But what we decided was that besides doing outreach for the child alone, here we will also help the caregiver or the parent in the situation.
Okay.
And that's how the organization started up. So Respite Care is actually a short giveaway, a short holiday or time away from your daily routine in taking care of these children 24 hours a day.
Oh.
That's what it is.
So, Zafreen, what made you start this Care for You Too? What was the changing factor and the deciding factor that, look, this is something over and above my medical practice, over and above my hectic schedule, I want to do this?
Okay. So for a long time, I, I felt that there was something lacking. You get this feeling that,
That
yes,
you need to do
that
something.
I need
I
to do something.
totally understand what
I
that
need
is.
to do something different, something else for myself, give back to community, but also Farzana. A large part stems from my growing up. Both my parents, my mom's late, but my dad is still with us, have been doing social work and community work their entire lives.
Wow.
So, growing up in a home where this was always prevalent,
It was a norm.
it was the norm. And stepping out into my own life and eventually, moving on, always felt something's missing here. What is that
Something
big
is missing.
factor? And then how did Care for You to come about? Quite an interesting story. One of my board members, who's also my auntie, she was a special needs teacher working at then Forest Town School.
Okay.
And she approached me to help her collect for a specialized wheelchair funding because this child only had a chair at school. He didn't have a chair for home use.
Okay.
Now that's exactly what happens.
So it was limited to only school usage.
Yes.
So at home there's
Yes,
nothing.
Yes.
Oh.
So, look, let's not get this totally wrong. Government plays a very big role here. They do amazing work with these kids.
Okay.
They do give wheelchairs to special needs children.
That's so great to hear.
Yes, they do. And obviously, as they grow, chairs have to be adjusted. Chairs have to be changed,
Okay.
because these children also grow.
They're growing, yeah.
They're growing kids. However, sometimes government is not able to provide more than one chair in certain circumstances.
Okay.
So
there is certain criteria.
there are certain criteria, but of
Right.
course, I think they are allowed to take chairs home as well. But
Okay.
but the biggest problem we have in our country, we don't have a transport system that actually accommodates for these wheelchairs. So these wheelchairs are very heavy. The battery alone is quite heavy. So maybe not the frame of the wheelchair, but the battery is what causes it to be heavy. And our taxis don't have space. They cannot load a wheelchair like this, for these children to and from home. This is by far our biggest challenge. In fact, all special needs schools do have their buses and they do have transport, which government gives schools to go and fetch these children from home every day or whatever. But out there in the local transport system, these poor children and parents are stranded. There is no other way to get these kids to where they need to go. So we started collecting for this child a wheelchair because it was needed at home. He lived with his granny.
Okay.
And what was amazing is we didn't know how we would collect this funds, because a specialized wheelchair can range anything between 5,000 to up to 120,000 rand for an 8-year-old
Wow.
child,
Okay. For an 8-year-old child. Okay.
depending on their condition, depending on the hip measurements, their feet, their back, whether their back is
So the
curved.
wheelchair is
whether
now
it's- so it's
specialized
specially
and
made for them.
especially for them.
Specially
Okay.
made for them. And Alhamdulillah, we collected that money. I think it was around, we needed 35,000 at that point. We managed to collect it within 2 weeks,
Alhamdulillah. That is
within family and
amazing.
friends.
Right.
And so we thought it ended here. And then Auntie Shanaz goes to school the next day, and with her co-teachers, so a special needs school works with a team. It's not only teachers. You have other medical professionals there that help to run that, to look after the kids.
Okay.
So part of the team they have is social workers, of course.
Right.
Then they have occupational therapists, speech and hearing therapists, and I think physiotherapists play a role as well.
Right.
And of course, all the teachers that are there. And so working with working with the team at school, they got chatting, and our board members at that point, Nicola Hay and Andrea Abrams. Andrea's the OT and Nikki was the speech and hearing therapist. At that point, they had at some point worked in the UK previously.
Okay.
And in the UK, respite care is very well known.
Okay.
So, and it's part of the NHI in the UK.
Okay, so it's that prevalent.
It's that prevalent.
Wow. Okay.
So, talking to Shanaz, the three of them, and they said, no, we want to pilot this at Forest Town. We have a family that's ready to go, like parents that are ready to go, but we just don't know how to get this off the ground.
Right.
So, here comes Auntie Shanaz back to Zafreen. Let's make a plan. So we said, okay, let's do this. So all we did was we reached out and asked, is there anybody willing to give us, some of their points to any resort nearby? And if I'm not mistaken, I think they managed to get the points, or we managed, I can't remember now, it was too long ago, but we managed to get Mount Amanzi at that point.
Okay.
And then we organized the entire transport and the food and, all of that, and sent the parents away for the weekend.
Okay.
How do we do this? Now, many people must be wondering, what happened to the child? Who looks after the child when this happens? Because, I mean, you're sending the parents away. These are the
Exactly.
caregivers.
What's happening now,
What's
yeah.
happening? So what we do is, we ask the parents to choose a family member that will come and stay with the child, who the child knows. Very
Okay.
important.
Okay.
You can't just go and put any family member there who the
Okay.
child is
No,
not
that's very
familiar with.
important that you're mentioning that, yeah.
And remember, we can't get a family ready in 2 days. It takes up to 2 to 3 months to prepare a parent to go away for one night, because there's something called separation anxiety, which needs to be dealt with first.
Okay.
Because most parents they don't leave their children at all. Children
I'm
are not
guilty of
separated.
that.
Yeah. So you can imagine in our normal setups,
In
what
our
happens
normal setups, yes.
in a special needs home, right?
So it's much more,
So it's
I
much
think it's
more.
much more worse.
It is. So then our social workers, our teams start working and start giving therapy, start looking and working with them. What are their concerns if they'll be away for a night or two? What's going to happen? What's going to happen with the child? Then the caregiver that's going to take over for that night or 2 nights.
Well, then
also,
meet the parents as well.
yes. So
that is so amazing.
yeah, so they also come on board, and then if they need the help in the therapy, most of the time it's grannies and uncles and aunts who don't really need much of therapy from our side, but
Right.
the mother, the parents, and the child, we
Definitely
do
do
that,
need,
right?
okay.
And then, but we make sure that there's food in the home. We make sure if there's a caregiver traveling from another town or a place, we cover all that costing. All of that is covered for the kids, the other children, and the special needs child at home. And then, of course, everything else that goes when we send the family away. So, alhamdulillah, to date, the plan is ideally to do 1 respite care case a month, but it's taking off very slowly in South Africa.
Really, that's so sad to hear.
Yeah, it's because there isn't enough awareness.
Okay.
We need to build awareness.
That's what we're creating today. So
Yes.
it's absolutely amazing what you're doing, Zafreen.
We're trying, Farzana, we're trying. And that's how it actually started up. So here were all of us, the 4 of us, Shanaz and I, on
Just
the
a pure
outreach
passion of
side.
making a
Yeah,
change.
from an outreach perspective. And here came Nikki and Andrea from a respite care. And then we
Right.
just decided, let's combine it into one organization. instead of doing random, one case here, one case there, and we started. So it was amazing.
It is, and I think it's very, very, very amazing what you're doing. So yes, we did touch on why did you feel there was such an urgent need for respite care. But like you said, there's not enough awareness. How do you propose that we create more awareness? Because this is something that is so amazing.
Yes. Platforms like these, Farzana, number one. Media. We need the media to come on board.
Absolutely.
Number two, we need to have awareness programs in different communities, in different areas of the country. So, although we try, look, we care for you to, in our 13 years, works in every province, if I can put it to you that way.
Okay.
Yeah. So we get individual requests coming through regularly from different areas of the country. And then we make sure we get the work done. So the trick here is there isn't enough dialogue happening for special needs
Around
out
this.
there.
Absolutely. Now I've got to ask you, you've mentioned you've been 13 years in existence. What are some of the challenges?
Our biggest challenge, finances, of course.
Yeah.
Secondly, the awareness. People don't want to show off their special needs child because this child is bedridden.
Okay.
But yet they are absolutely beautiful, the most
And
intelligent
I've seen, I
children.
was just going to say this, they are some of the most intelligent children you'll ever meet.
Absolutely. Absolutely.
And most loving.
Very, very. You know, working with them will humble you, Farzana. It humbles me. It humbles me the strength that these parents have. The strength in these homes is something else. I mean, we have challenges across the board. Orphans, widows, you know, all other organizations. But this is just something else.
So Zafreen, you mentioned obviously that, there's much more awareness that needs to be created. But where can our viewers reach you? I think this is such a phenomenal project to be a part of.
Okay, the best way to reach us is via email, Farzana, because
Okay.
all my team members are working.
Okay.
So our email address is info@care, the word care, CARE, the number 4, the small letter U, the number 2.co.za.
Okay. And then tell me, a woman who wears so many hats, what is one motivational quote that you ascribe to?
Your actions are your results of your intention.
Oh, beautifully said. Zafreen, I want to thank you so much for joining me on Visionary Pulse. It has been an honor and a privilege chatting to you. Jazakallah.
Thank you so much, Farzana, for having us on your show.
So that brings us to the end of another wonderful segment of Visionary Pulse. Join me, Farzana Mayet, next week as I chat to another game changer and change maker. Good evening and assalamu alaikum wa rahmatullahi wa barakatuh.